had a diagnosis of BPH. Because of that diagnosis, I required surgical intervention. Instead of it being done in my country, in Malawi, we had to look for a better hospital where this procedure would be done. My name is Mark Fenton Sharif from Malawi. I came here at Yashoda Hospital on the 23rd of February 2024. I had a diagnosis of BPH, which is benign prostatic hyperplasia. Because of that diagnosis, I required surgical intervention. And instead of it being done in my country, in Malawi, we had to look for a better hospital where this procedure would be done. And this is a TURP, which is a transurethral prostatectomy. So we looked for a hospital and we found Yashoda Hospital, which of course we're in partnership with, because I am coming from a Medical Aid Society of Malawi, which is called MAZIM, as a private funder. And when I came here, of course we flew from Malawi to Ethiopia, from Ethiopia to Delhi, and from Delhi to Hyderabad, India. When we came here, of course, we were received at the airport by this amazing driver. So we had a transport pickup by Yashoda Hospital with the driver, and we got to the guest house. The guest house facilities were fantastic. We also had a guest house caretaker. They also managed to give us our SIM card just for communication, WhatsApps and phone calls. So I was still close to my family in Malawi. The accommodation was amazing. I was given executive accommodation for some reason. In fact, the way they treated us every single day, I mean, with the people that were assigned to my care. We also had my case manager for the case that I was going to have. For the surgery that I was going to have. We also had the logistic person who was also assisting us. Every single day they'll give us phone calls, sending us WhatsApp texts, finding out how we're doing, not just that about my health, but also our daily living. And later on, of course, we visited the hospital. I didn't do anything, but my case manager was able to discuss my issue with the doctor on the booking, the treatment plan, including the day I was in hospital, the first time I was in hospital, taking me to the diagnostics and also taking me the lab, interpretation of the results by the doctor. He was able to plan everything, and I was just seated back and relaxed. It was attention that was given to me that was beyond problem expectation, I should say. And then from the hospital, of course, from the doctor taken through the surgery and all the way to the admission. We're looking at the environment as well. The hospital is nice and clean. The ambience is great. I mean, it's more than what I would expect. Probably I would say it's a five-star hotel in a hospital. The food and the greetings every morning, several times you'd see probably a number of people coming in, the nurses, other caretakers, the doctors, including my logistical person and my case manager. They would always appear almost every hour just to have a greeting, to find out how I was doing while I was in hospital. My doctor who was doing the operation for the BPH, who was taking me through the TURP, Dr. Srinivasa Gutta, he was also very kind. Taking through, explaining what the condition was, taking me through what the diagnosis meant, including the diagnostics that I did, which is all the labs, urinalysis, full blood count, HBCs, everything that I did in hospital, including the radiology. He took me through the interpretation, what that meant, and also the prognosis of the procedure. The treatment that I was given, he took me through the medicines that I'll be taking, including the care after the hospital. So even after the hospital, the reviews that I was doing, he also took me through every step of the way to understand what I'm going through and what the prognosis will be and how the healing will be. The professionalism that you find at Yashoda Hospital is first class. It's beyond what you'd expect in probably any other hospital.